So for our next session, we have Mr. Feby Abraham, EVP Chief Strategy and Innovation Officer at Memorial Hermann Health System, will guide us through the intricacies of running digital innovation and investment in a health system. This is a session that you really don't want to miss. Please welcome everyone, Feby Abraham, to the stage. Huge round of applause for Feby Abraham.
Well, good morning, everyone. You heard so much about Indian innovation and innovation in the previous sessions. It's a tough act for me to follow because I'll take you to a tour of US healthcare. For those of you who are interested, you'll sort of get a little bit of a preview of what we're doing in the United States in terms of market trends and how we're driving innovation and investments from that vantage point. So before I jump in, just a little bit about myself and my background. I've been back to Bombay after 24 years. I studied in Powai, graduated in 2000, and I've not been back to Bombay since. I've been back to India many times, so it's a little bit of a homecoming for me to Mumbai and seeing so much of the development that's happened in the interim 24 years. I moved to Houston and did my advanced studies there and worked as a computational scientist and AI engineer back in the days for some years before spending more than a dozen years at McKinsey & Company. I was a partner in the private equity practice in the United States. And then most recently, I've now taken over this role for the last 4 years in leading strategy, investments, and innovation at Memorial Hermann Health System. So what I'll do today is just give you a lens of who Memorial Hermann is first, just to sort of set the stage, and then talk you through, as Dr. Earlier in the day, we heard the presentation about next practice, not best practice. So I'll talk about some of the next practices we've created in the investments and innovation landscape within Memorial Hermann. So Memorial Hermann is a health system focused on just Greater Houston. We've been around for over 115 years. Just about 6,500 physicians in our network, north of 34,000 employees now, about 17 hospitals, and we've been there for the community for a long time. Just in terms of some numbers, I think the number that inspires me the most is we deliver about 30,000 babies every year, do just under 200,000 surgeries annually. Obviously, the scale is very different in India. We have just shy of 4,500 beds, and the system generates about $8 billion in revenue, and all focused in this Greater Houston corridor. So that's the context with which I'm going to talk about. There is a lot of other things that happen within a not-for-profit health system in the United States, just to sort of bring you up to speed on that. Contrary to all the work you all are doing in terms of underserved and uninsured communities, where government plays a big role, health systems play a big role in India, we, as health systems in the United States, are at the vanguard of it. We obviously leverage a lot of government support as well through Medicare and Medicaid. But furthermore, there are no government hospitals at scale beyond the VA. So we spend a lot of charity dollars in taking care of the community. And one of the numbers on this slide is just under $500 million we invest in what we call charity care for the communities. We also have our own helicopter and fixed aircraft fleet that takes patients in critical care, so if accidents and so on, and bring them to the core hospitals. So what I'm going to do today is to really talk about as we've built up the innovation and investment landscape within Memorial Hermann. I've been on this journey for just about 4 years. Joined early 2020, the height of the pandemic. I actually joined just 6 weeks prior to the pandemic. And it took some time to build it. But what I'm going to share is some reflections and learnings. Hopefully they're applicable in the Indian context. I think they would be. And talk about 5 themes or points that at least have stuck with me as I've been on this journey to build it. The first is, to really frame what the core trends are in the industry and what the core beliefs on what the future will look like in terms of healthcare. And that's where I'll talk about some of the major dynamics of US healthcare for you all. The second is, how do you shape that market? What do you want that healthcare of the future to be, and how are you going to shape the right products and services to enable that? Third is connecting innovation priorities tied to that strategy. And fourth is really developing the capabilities, the infrastructure, the people, process, and technologies, and obviously the capital allocation. So it's capital allocation and people allocation that enable how you sustain innovation. And finally, what are some of the cultural dimensions that are required to drive innovation at scale? This notion of scale is obviously an important one. Vishnu raised it. And so I think we should sort of think about scale and impact. How do you drive that, and what cultural aspects are required to create that? So I'll go with the first point. I'll just address each of the points one by one. I do love this quote, so I thought, I just sort of use that for your purpose, from Desmond Tutu, who basically said, there comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in the first place. So with that, let me just sort of give you a quick tour of the US healthcare landscape. There are many trends, but I've distilled it down into just 5 main sort of trends that are shaping US healthcare today. The first, just to sort of give you some sense of numbers, the US spends about $4.5 trillion on healthcare. That is larger than the GDP of India. That is larger than the GDP of Germany as well. So we spend about 20% of our GDP on healthcare. The average industrialized nation, the top 12 countries who we benchmark against, spend about 10% of their GDP on healthcare. So we spend double, and we don't get better outcomes as well, at least the headline numbers. When you take infant mortality rates, maternal mortality rates, even average lifespans are at the lower end of those, among those 12 countries. So we spend a lot and we don't get a lot of it. And then the spend is not just limited to governments. So of the $4.5 trillion, roughly a third comes from government. A lot comes from employers. There are 160 million people who are covered by employer insurance. And employers bear a brunt of the healthcare costs as well. So for example, a company like Starbucks, just to give you some staggering statistics, Starbucks spends more on healthcare for its employees than on the purchasing of coffee. So if you just digest that as an example, that's the scale of the challenge we're dealing with for employer healthcare. So there is this whole discussion that's coming on shift to value. What is shift to value? It's basically not just focused on cost, but how do you sort of look at outcomes and cost together? So how do you sort of combine the product that is reducing the total cost of care? So we should not only just be at the vanguard of new innovation in terms of kind of coming up with great technologies that improve lifespans of people, but how are you also doing that in an affordable way? That's one trend that will have to happen in the United States, because given our debt levels and where the trends are going, it'll be quite unsustainable. The second is that there is a real big labor shortage, and the pandemic really accelerated it. So the headline numbers are, we're in shortage of about 300,000 nurses in the US, just about the same number in terms of primary care docs and specialty docs. Unlike what you have in India, if I want to take a primary care visit, it may take me 2 or 3 weeks just to get an appointment. So there are those challenges in terms of labor shortages, which, if you project forward, it needs to be addressed as well. And the main driver of that addressing historically has been supply driven, which is, if I have a shortage of people, I need to produce more people that do that work. But I can't create 300,000 new workforce instantaneously. So the real discussion has to be around productivity. There are 3 industries, or only 3 industries where productivity has declined in the last 60 years in the United States. They are healthcare, government, and education. All other industries have grown productivity significantly. So one of the main, concepts we discuss in US healthcare is how are you going to dramatically boost productivity of the workforce, obviously supplementing a lot of digital technologies we're going to talk about. The third is margin pressure. So it's particularly on providers. But what happens is, the reimbursement rates don't really stack up relative to the growing cost of inflation of labor as well as products, like next generation pharmaceutical devices, all that stuff. So there's a margin contraction which creates a problem for next generation of investments to solve the US healthcare challenge. The fourth is competition for consumer access is intensifying. Historically, healthcare was largely driven by health systems and payers. But now a lot of the other entrants are sort of saying, hey, 20% of GDP, why are we not focused on that? So your large tech companies like Google, Microsoft, Apple, Amazon is big into healthcare now, at least they're making big investments. Your large retailing companies like CVS, Walgreens, who traditionally played a role in pharmacy only, are moving towards healthcare delivery. And then insurance companies, the largest provider group right now, through a lot of consolidation and M&A, is right now the largest payer in the country, called United Health Group. So the insurance industry is spending a lot of money on M&A, but they're not doing that in traditional insurance products, they're doing that in provider, which is creating obviously a significant ripple effect also in the provider ecosystem, because we may not be the front door for everything that historically we were driving. And finally, there is a growing need and recognition that digitization and consumerism needs to work its way through. And specifically what I mean by that, and there were some great examples provided for our COVID card from one of the previous presentations. We don't have that level of digitization and consumerism, but consumers are asking for more. The trends are changing, and we're making significant investments to that effect. Trying to make it work. All right, I think it worked. Okay. So if those are the core 5 things that drive US healthcare, I sort of simplified it a lot just to give you a very quick 2-minute overview on US healthcare. What are some of the strategic steps that we have to take, or when we think about shaping the future of products and services when it comes to US healthcare from a health system perspective? Everybody has got a vision statement, a value statement, a service commitment, and a service standards, which we at Memorial Hermann also have. But the one thing we have taken in terms of the collocation of all those 5 trends is that we're not just going to be focused on hospital level of care. We have redefined our vision to build healthier communities. So not only are we a hospital company, not only are we a healthcare company, we want to consider ourselves as a health company. And so that's the sort of underlying architecture I want to drive in terms of vision, which then drives strategy. We have codified that under the health acronym, which basically takes the sum total of all those trends and puts that together. So how do you create humanized consumer experiences? How do you drive high reliability care across all of the way in which care is delivered? How do you align the physician network to sort of be able to do the way we want evidence-based care to be practiced with a lens not only towards outcomes but total cost of care, which is a completely different mindset, right? Because you're not only focused on fee-for-service surgical volume, you're taking care of maybe even driving down surgical procedures if they are the right answer for the patient. You're lowering the total cost of care. You're transitioning to this value-based healthcare that I was describing. And finally, how do you make smart programmatic investments to drive all this and make this happen? I love this quote. Basically, people don't want a quarter-inch drill. They want a quarter-inch hole. So let's start with the unmet need and the pain point first and walk backwards from there to what solutions are we trying to drive. So I really think digital health is foundational to everything, but we should start with what is the clinical problem or the underlying problem you're trying to solve. It could be clinical, it could be non-clinical. So what we have done is, from a strategy, investments, and innovations, we've kind of created 6 unmet needs or uncharted areas we want to sort of really be at the vanguard of creating products and services. First is healthcare services that are outside the 4 walls of the hospital. So how do you do care in the retail setup, in the home setup, in population health setup, say if you've got kidney disease or you've got cancer disease, how are you going to solve some of those problems, but outside the 4 walls of the hospital? The second is how are you going to integrate tech and digital across all of your clinical, administrative, and operational workflows to really boost productivity and be at the vanguard of reducing total cost of care. The third is around consumer whole health, where you don't have to say that medical level of care is the only mandate of a health system. We all know that diet, pharmacy, social determinants of health, even access to transportation, genetics, access to preventative care are all important for the overall health and well-being. So why are they being served by multiple different constituents? Who's playing the app store or the platform role in integrating and creating the ecosystem of consumer health, whole health? We believe we should be able to do that. That's the whole point in consumer whole health. Reliable, efficient care is to reduce the variation across the way care is practiced within our network, whether it's at a clinic level or at a hospital level. And finally, we have two other kind of concepts, which is how do you take primary and specialty care that was simply geared towards number of services or unit of services, like number of orthopedic services, to something that is more total cost of care. So, hey, do you need hip surgery? Could you really do rehab instead and get the same outcomes? And then the final point is how do you create the risk-bearing products that enable the economics? So if I, for example, forego surgery, ultimately who's going to sort of be at the front end of benefiting from that? The patient. But the hospital obviously loses economics from that. That won't drive incentives and behaviors on its own. So how are you going to create an economic model whereby by doing away with unwanted surgeries, you can still create the right economics, whether it's by creating health plan products or risk-bearing products that work with insurance companies to have that type of incentives. That's more of an incentive alignment mechanism. So these are the six sort of priorities or themes we developed. Now I'll go to the innovation capability and how we sort of thought about developing that. So we said, okay, look, here are the six priorities. Ultimately, all strategy when you don't have capital allocation and people allocation identified, it's just PowerPoint. So let's think about how you're going to create the right vehicles to be able to enable all of that. So what we did is we created three kind of arms. One is to say, we are going to be the app store, the Apple App Store, or the ecosystem that drives health for the communities. We can't do it all. How do we partner, invest and bring even M&A, acquisitions, of new models that have created the right mousetrap and bring that to the community through joint ventures and strategic partnerships? This is the number 2 item on this. The second is, how do you create innovation alliances? So with untested ideas, right? Like when you have startups, new companies who are coming and developing solutions to specific unmet needs and pain points. How are you going to create a mechanism whereby those innovations are tested in a pilot then scale approach? So could you do that testing in one clinic or a handful of clinics or a hospital before you scale it across the platform? And the third is how do you develop a venture? And I obviously have a foundationally different understanding of venture capital than vulture capital. So I think that what's the right mechanism to create an investment paradigm to support these companies so you're partnered with them for the long run. So we created those three arms. And then over the last 3 years, we really scaled our platform. We have to date made about 42 investments in various companies that are aligned with our points of care. We've now brought about 22 or so scale ideas into the platform. And we have about 18 innovation hub pilots running over the year and a half that we have in under operation. 6 of them are now scaling. The others are in various stages of testing and development. And we really think about that as an A/B testing paradigm. We're really solving the unmet need and pain point. Let's see if this innovation works. If it works, how do you scale it? There are multiple ideas across the theme. So as you can see, digital is the second column, but we've got other ideas too. Like for example, there are companies that do next generation of oncological care at the home. We have a new platform called MIDI Health that supports women in their menopause journey, which we realize in the United States is a completely underserved market. We have Monogram, which basically supports kidney care for high complex kidney care patients who are basically dialyzing and spending a lot of cost of care in unavoidable emergency room visits and so on, so that creates a paradigm. There's a lot of care at home companies, retail companies, ambulatory surgical centers, new digital models. There's also Food Smart, which is like basically food as medicine. There's a genomics company out here. And then for roughly 75% of these companies, we've not only invested in the companies, we've also brought those care innovations to Memorial Hermann. So it's a dual alignment. We have a venture investing that sort of monetizes on the returns of these companies, but we also have the alignment as a hospital to bring those innovations to our market. I think I talked about some of these innovations. Ambience, I think, is an interesting one. It basically does AI-based listening for the doctor-patient interaction and takes a note fully through large language models automatically. So we've realized it basically creates a way in which the provider productivity has gone up by 40% or so. Finally, culture eats strategy for breakfast, of course, and so we can't just thrive on strategy alone. How are we sort of, as we've learned this over the last 3 years of building some of these concepts, what have we learned? We want to start, number one, with sourcing the unmet needs and pain points. We don't want to be a hammer in search of a nail. We don't want to say, hey, look, let's evaluate this company, but what's the problem you're solving first? Let's be very articulate about that before we start any of this. We have to be having the mindset of rapidly identifying and deploying solutions and sort of failing fast if something doesn't work. We're open to saying that some ideas will not work. I tell my team this all the time, that if all the ideas you're bringing are going to be working with 100% probability, you're not thinking big enough. So you really have to sort of take the mindset of finding ideas and being sort of okay with some of those concepts not working. We have to think about innovation from a flywheel concept. It's okay to sort of say, hey, we're going to shoot for the moon and start with big ideas, but really sort of setting up a flywheel enables a cultural transformation of adoption, which we think works a lot better than trying to sort of, shoot for the stars and then not being able to do anything. So work on a portfolio of ideas that are both big ideas and create the flywheel of innovation. And finally, I think this is one area where I feel a lot of systems are still trying to find their mousetrap, which is how do you sort of articulate the value creation for the system? What's the financial and non-financial benefits or value creation for the system? I hear this all the time that, hey, we have a great digital health idea, but we run into this bottleneck with our CFO or CEO, which is they're talking about budgets. Like, what's the budget for this? Like, how much does it cost? How are you going to reposition innovation as a value center, not a cost center? And how do you sort of define the value creation for the system is an important part of the journey. Doing that articulately, in my view, really helps scale innovation. So those are just a simple set of thoughts that I had from sort of building some of this in a US health-based system based on Vishnu's guidance of what we think would be useful for this group. I'm here all through the day. If there are other questions, I know we'll be doing a panel also to take more questions. So with that, thank you for your time.
Thank you so much, Mr. Abraham, for being on the stage and providing us the insightful presentation on health strategy and the crucial connection between innovation and investment ventures in healthcare. Your discussion on innovation capabilities and strategic investment objectives and focus areas were both enlightening and thought-provoking. As we reflect on his words, we actually understood that why I called investment and innovation are the twin engines for healthcare ventures, and it is really important. So thank you so much, Mr. Abraham, to be on the stage.